No, no.
Common.
Sternocleidomastoid. Sternocleidomastoid. What I want to show you is that the internal jugular is passing deep to the sternocleidomastoid as it's joining the subclavian to become the brachus phallic. Proximal to this anastomosis, there is another vein called the external jugular that runs superficial, like this, okay, to join the subclavian vein. So the external jugular joins the subclavian before an anastomosis with the internal jugular. But the external jugular is superficial to the sternocleidomastoid, whereas the internal jugular is deep. So if we look here, you see this vessel running superficial to the sternocleidomastoid. That's got to be the external jugular. Here's deep to it. It's going to be here, the internal jugular. Now, let's go back. This is not on your list, but I'm going to say it because when you dissect the dogs, you'll see this vessel maybe. Okay? Here's the superior vena cava. You see this vessel that's joining the superior vena cava? It's called the azygos vein. The azygos vein is collecting blood flow from all these little intercostal veins within the chest. They're draining into the azygos, which also then drains into the superior vena cava. So the superior vena cava is receiving all venous drainage from above the diaphragm. Good. Let's have a volunteer again. I want to volunteer. Anyone wants to be bold, be brave? Okay. Very good.
As long as I don't have to show my hairy legs.
We've got to be discreet here. Okay, Sarah, come on back. And y'all can all come up here because you'll get to see this. He said we want you to relax, lie down. I want you to remember that these are future healthcare professionals. Okay, this is a safe environment. What I want you to do is bend your legs. Okay, like that. Yeah, there you go. Very good. Okay. Now, what I want you to do is turn your head to the left. Okay? Let's do this right here. Right, about like this. All right? What do you notice here? What do you see? You see the sternocleidomastoid?
Did you see that one?
Yeah, what is this vein?
Jugular?
External jugular. It's much easier to see than the internal jugular. Okay? But if someone has a normal volume status, and they're lying supine, we should be able to see the external jugular. It should fill up with blood, okay? And it's, you know, it's distended at least halfway up to the angle of the jaw here. And that's pretty common, that's pretty typical. What do you think would happen if she was volume depleted or dehydrated?
Wouldn't see.
You wouldn't see it, even if she's supine. So that would be one physical finding that would correspond to volume depletion. What would be another finding, you think, if someone was dry? Their mucous membranes would be dry. So, yeah,
So
see,
they'd be dry on top.
well, when I say mucous membranes, I mean like the
Nose.
mouth, the tongue. You ever hear a physician say, stick your tongue out?
Mhm.
He's looking for moisture. Your tongue should be moist. If it looks dry, that would be another finding consistent with volume depletion or dehydration. And sometimes they'll do this. They'll pinch a little skin to check for skin turgor. See how it bounces back? Okay, that's a sign of health. Tip-top shape here. But if I were to pinch a little bit of skin, it would begin to tent and be slow to return. That decreased turgor would be a sign of volume depletion. Okay? Now, what we're going to have Sarah do is now sit up. Now, again, turn your head slightly to the left. Just going to look here. Chin up like this. Okay. Do you see the external jugular? Now, it collapses when she's sitting up, okay, because blood is draining back to the heart. If she was volume overloaded, or if she were in congestive heart failure, even in the spine position, would see it distended, a hollow up to the angle of the jaw. Okay, that would be an indication of volume overload. So we use the jugular veins as an index of volume.
So like when people are yelling, why is it when you're sitting?
Well, because they're increasing intrathoracic pressure, which impairs drainage. All right. Thank you. Yes. All right. What do you think causes varicose veins?
They say really disabled.
No.
No, because young people.
It's a big congenital. What do you think causes varicose veins?
Maybe the stretching on the skin.
Stretching of the skin.
I know I got them whenever I was pregnant and my daughter was sitting on certain parts that weren't getting enough blood flow.
If, for instance, the pregnant uterus is compressing the common or the external iliac, that's going to cause an increase in venous pressure in the lower extremities. And here's what happens. Let's say that's the external iliac, that's the femoral vein, comes down to the femoral vein. You have all of these communicating veins that are extending out toward the southness. So as you go down distally, you have these communicating veins. And we said before that these have valves. That the deep veins have valves like this. That assure that these valves assure that blood returns in one direction, from distal to proximal. It ensures that blood is flowing in this direction back toward the heart. Now, what happens when you're pregnant? The pregnant uterus may be compressing the external iliac or the common iliac. And when it does so, what happens? These veins become distended, right?
Mm-hmm.
And then you pull the valve cusp apart, and so blood begins to regurgitate. And as blood regurgitates, it's going to cause more distal distension. Okay? And so that distension, it pulls the walls of the deep veins apart, and the valves become incompetent. Now, when volume regurgitates distally, pressure increases. Okay? And this pressure can move retrograde into the communicating veins, which can also become distended, like this, pulling the valves apart. And so venous blood is going to return now back into the superficial system, which now becomes distended. And your veins become distended and gnarly, and they can become painful, tortuous. That's one way of developing varicose veins. Pregnancy tends to precipitate or trigger them in many people. Many people have a congenital predisposition. Your mother had them, you're more likely to have them. But certainly pregnancy, certain occupations where you do a lot of lifting and increased venous pressure can predispose. But ultimately it's because the valves, the venous valves, become incompetent, allowing blood to flow back into the venous system, distending those superficial veins. Does that make sense to everyone? There we go. That's it. That was the answer. That was the answer. Where would you learn about that kind of thing, and what kind of course? Well, the course you take in your second year of medical school and first or second year of PA school, pathophysiology. or in medical school they call it pathology. Okay? That means how do you develop these abnormal conditions, these disease processes? What goes wrong? Okay? All right, let's do this. So just look at the thing, man. Let's just go over it. So let me ask this question. Is the thin man our friend? Yeah, he's here to teach you. He doesn't ask for much in return. He's a nice person. What are we pointing to here, by the way? What is this space called? Mediastinum, yeah, the mediastinum. All right, so what is this vessel here? Superior vena cava, that's absolutely correct. What would this vessel be called?
The left brachiocephalic.
The left brachiocephalic vein. Again, I want to emphasize that you have a right and left brachiocephalic vein, but only a brachiocephalic artery. There's no right and left. Okay. What is this and this?
The external jugular.
Right and left internal jugular. These
Oh,
are draining
internal.
blood from the brain.
So those are the internal?
Those are internal. Now, they don't show the external jugulars, but if they did, they would be superficial to the sternocleidomastoid. So the external jugulars are draining the structures that are receiving blood flow from the external product. So it'd be the scalp, the face, the neck. Okay? Those veins from those regions would be draining into the external jugular and then returning to the venous circulation to the superior vena cava. What is that right there? What vessel? A little tricky.
Pulmonary vein? No.
This is the trunk. Left pulmonary artery.
Oh, artery.
Left pulmonary artery. Let's take this thing.
Oh, because it's carrying blood away from the heart.
Oops, sorry.
That's right. That's correct. What do you think this is right here? Number 91.
Gastric. Artery.
No, that's the celiac trunk. Let's see. Make sure I'm right here. Yeah. That's a celiac trunk and a celiac artery. It's giving off all these branches, one of which is going to the spleen, one of which is coming up here to the liver. That's called the hepatic artery. Right next door, number 88 here, is the portal vein. So again, the portal vein is carrying nutrient-rich blood, the hepatic artery, oxygen-rich. Okay. What is this vessel here?
The
In red.
inferior mesenteric.
Superior mesenteric artery, and in blue would be the superior mesenteric vein.
Oh, that's the superior?
This would, oh, I'm sorry, inferior, my
Okay.
bad. Superior's on this side.
Right.
Thank you. You're on your game. Where's Sarah? You hide? Oh, over here, okay. What is this vessel right here? The right external iliac vein. So here it becomes the
Femoral.
right femoral vein. Now, what is this vessel here?
Saphenous vein.
No, this is the great saphenous. The great saphenous extends along the entire medial aspect of the lower extremity, from foot up to groin.
So would we be able to see the lesser?
No, we don't see the lesser, or it's called the small saphenous, but we don't see it. Okay, not on this picture, we're looking at the front, but maybe we'll see it on back, we'll see. So you can see that the great saphenous comes all the way up here and then dives deep and plugs into the femoral vein. What is this vessel, number 120? Inferior vena cava. What do you think 121 is? Multiple veins of this type. Hepatic vein. So they're draining the liver right before it then passes through the diaphragm and enters into the right atrium. What are these veins?
Renal.
All right. Notice that the inferior vena cava sits to the right of the abdominal aorta. Now we're not going to see anything back here. All right, let's go over here. Let's look at the wall vein. What is that vessel right there? Pulmonary vein. There we go. Yeah. So that would be an hepatic vein that's draining from the liver into the inferior vena cava. Okay. What would be this one here? So that would be the right renal vein. What is this one right here?
Medial cubital.
Where to take the
Median cubital vein, where they draw blood. What would this one be? Cephalic vein, right. Okay. What would this one be?
Isn't that the great saphenous?
Looks like the great saphenous vein. Oh, no, hold on. No,
No.
I'm wrong. This is a deep vein. You see what's happening here? This was the great saphenous. It's plugging in from more superficial position. So this would be the superficial femoral vein, which is actually a deep vein, corresponding to superficial femoral artery here. That's a little bit tricky.
Superficial is deep.
Okay. In that case. Yeah. All right, I think that's all we have to do for today.